this. So at the upper left-hand corner, I ask that you follow along as if you're reading a document. In the upper left-hand corner, the first question we ask is, in the past 10 days, have you been tested for COVID-19? And if the answer is yes, then you move to the box below. The question below that is basically, have you got the result yet? Is the result positive? If you are tested for COVID and it is a positive result, Department of Health will take over and they will put you in isolation, and they will put your family members, household members in quarantine. They will also do then some contact tracing. So let's say in the past 10 days, you have had a COVID-19 test, but it's negative. So, or you haven't had a COVID test. You move to the next box. The next box says in the last 14 days, has the student or staff member traveled outside of the country into an area that the CDC has basically identified as a hot zone? Or have you traveled to a state in the United States that is on our New York State travel advisory list? Or have you been designated a contact of a person who was tested positive by the health department? We've had some questions here about the travel advisory list. If you travel outside of New York and you are in a state that is on this travel advisory list, and you actually are staying in that state for upwards of over 12 to 24 hours, then you are considered to have been in a travel advisory state. If you are traveling through a state, say let's say Pennsylvania was on this list. It's not, but let's just say you're traveling from New York to Ohio and you drive through Pennsylvania. Just because you drive through a state that is on the travel advisory list, that does not apply to you as being in a state on the travel advisory list. If, however, you stay in a state on the list, you now must abide by the Department of Health rules, which would put you into a home quarantine. I advise every single person that I hear that is traveling outside of New York, I advise them to go to the New York State coronavirus page to look at the travel advisory guidance. There is a place where you can actually put your name into, so you would be assisted with contact tracing. I bring this up because if you travel outside of New York into a state that is on the advisory list and you use that form, oftentimes the contact tracers have been able to work with the person to get them out of quarantine prior to the full 14 days. If you're a student or a staff member that travels outside of New York into one of these zones, one of these states, and you do not use that New York State advisory form that they have on their website, you will be out 14 calendar days. Only the Department of Health, through the use of that form, can get you out of that 14-day quarantine early. There's a note there that basically states that even if you have a negative diagnostic test, you don't come out early. It also states that school staff are not essential workers, so if you travel outside of New York, you too must quarantine. Now that third bullet in this section says, have you been designated a contact of a person who tested positive? The Department of Health will do their contact tracing and will let people know who are contacts of someone who is COVID positive, and they will give guidance to that individual or that family. Only then, only can the Department of Health clear an individual who has been designated a contact of someone who has tested positive. It is very important with these first two that you do pay attention, because if we want to stay open, like Superintendent Farr has said, we have to be very mindful and reduce our risk of spreading or our risk of having COVID or other items spread, and we want to do all of our best that we can to make it so we don't turn into one of those zones. The third sort of orangish salmon box is about the symptoms. If you, as a student or staff member, has experienced any of those new symptoms or worsening symptoms, this is important to know, because if something is new, something is worsening, getting worse, you will have to answer yes to your health screener. If you answer yes, that you have any of those symptoms, you, the student or the staff member, cannot be at school that day. You are strongly encouraged, and the strongest encouragement I can give you, you are strongly encouraged to contact your healthcare provider. That is the guidance right there. If you are symptomatic, contact the healthcare provider. They will then take over and they will do a couple of things. I'll get into that on the next slide. If you don't have any of those things and you say no, you're good to go. Come on to school. Don't forget, wear a mask, socially distant, and wash those hands as much as possible. Superintendent Farr, can you switch to the next slide, please? All right. So now let's say you, the individual, student or staff member, has a symptom, or you have been exposed, or you have been out of the state. So if, let's say you have a symptom, at the top, this is the symptoms flow chart. This is how you can get back to school. You have a symptom, flat out, 100%, contact your healthcare provider. If you notice, at the top, it's got that salmon color, then right below is the blue bar that says healthcare provider evaluation. We cannot stress enough. You have to see the healthcare provider. It can be in person, it can be virtual, it can be urgent care, it can be your primary care, whatever it is. We really recommend, if you're symptomatic, you see a healthcare provider. The healthcare provider is going to do one of two things. They are going to either recommend a COVID test, or they're going to review you, review your charts, review your medical history, and they possibly could come up with an alternative diagnosis. So please notice, let's start with the recommended COVID test. If your doctor, your healthcare provider, if you see them and they recommend a COVID test, you're completely out of school, at home, until you get the results back. If the results come back and they're positive, public health will take over and they will make determinations of when you can come back. They will also conduct contact tracing. If you have a negative test result, this is important. I want every adult to be a good consumer of your healthcare. If you go to your healthcare provider and you get a negative test result, do not walk out of that office without one of two things: a copy of that negative test result, or a note that says healthcare provider indicated test was negative. Now, I just said don't walk out of that office, but we all know these test results are not instantaneous, so they will most likely communicate that to you through email, through a text message. That email, text message, notification, that is your ticket back to school. You have to present that to either the school nurse if you're a student, or if you're a staff member, you need to present that to your main office. You can do that in advance through email, that's fine, but the negative test result documentation is how you get back to school. You cannot come back to school without that, if the healthcare provider has recommended a COVID-19 test. Now, let's say you go to your healthcare provider and they do not recommend, based on your symptoms, based on your medical history and how you're presenting, they don't recommend a COVID-19 test. They come up with an alternative diagnosis. If you are at your healthcare provider and they are going down this road of an alternative diagnosis, be a good consumer of your healthcare. If they give you that alternative diagnosis, walk out of that office with a hard copy or an electronic copy that you have seen that has the following. Right below that arrow, I'm going to point a few things out. Your healthcare provider must explain the alternative diagnosis. They cannot just say unconfirmed illness. They cannot just say cold. Though that healthcare provider has to give explicit explanation or terminology that does provide the alternative diagnosis. They also need to have a statement on there that says COVID-19 is not suspected. Those parts of a note are required. The nurses in the school cannot accept a note that says generic unconfirmed illnesses, and the medical community knows the terminology that does that. Basically, at the bottom, it says viral respiratory illness, viral gastritis. Those do not cut it. If you, as a parent, as a staff member, if you choose not to abide by the healthcare provider's instructions of getting a COVID test, or you do not go see the healthcare provider, you will fall under something called presumed positive. If that happens where you ignore the healthcare provider's request for a test, don't go see one, if 48 hours pass and you haven't done that, you will be presumed as if you are COVID positive, and everything under COVID positive applies. Let's say it's day 3, day 4, and you still haven't gotten your test, or you still haven't gone to the healthcare provider. You are out of school, you are out of work for 10 days minimum, and we have to notify the Ontario County Public Health. We strongly encourage you to go get that test, go see that healthcare provider. So let's say on day 5, you get the courage up, you go to the healthcare provider, you get the test, you get the results, you can come back with the appropriate results or the appropriate diagnosis. But if you don't do that, you will be out for at least 10 days. The window has to pass by from when you were symptomatic. And you also have to be fever-free for at least 72 hours. Please note, this is if you don't get a COVID test or you do not get evaluated by a healthcare provider. Next slide, please. Ooh. Okay. I'm sorry that, next slide after that. That's the one I want. There we go. This is quite of an important slide here. This slide at the top says COVID-19 exclusion protocol for contacts. This was very confusing across the state, and a lot of us didn't know what this really meant until it was explained by the Department of Health. If you have a family member, a friend, somebody you are close with who does come down with symptoms and has to see their healthcare provider, this is where you will fall in line. So let's say, for example, my brother, who I'm very close with, comes down with symptoms. Now, I'm with my brother every day. And let's say my brother gets an evaluation within 48 hours. This is where I'm following the flow chart in the yellow box. My brother gets an evaluation within 48 hours. The healthcare provider gives an alternative diagnosis. I, the contact, am clear. No exclusions required of me. Let's say my brother is told to get a COVID-19 diagnostic test, but he refuses. Notice the red box, it's a little orangish. We have to follow the protocols on the page that I just showed you to assist the local health department to do a full investigation. He's presumed positive because he refused, and because I was a close contact, I now am falling under that isolation. When you see this, the bottom boxes that are green and reddish orange, those are the contact results of someone who has been exposed to somebody who is symptomatic. So please take note of this. This is very important to know. So I have been physically close to and exposed to my brother. My brother is symptomatic. Nowhere on here does it say someone who I then secondarily have been connected with. Example, my brother and I are out together the whole time. He's the one that's, symptomatic. And then my brother goes away, he does his thing, and then I'm now with a bunch of other people. Let's say my coworkers. Let's say my wife. My wife, my coworkers, they are not a contact of somebody who is symptomatic. My wife, my coworkers, my friends, they're fine. It only occurs with the chain of the person who has been directly in contact with somebody who is symptomatic. This is critical because we are a large community. Somebody is bound to get ill, and when they have their symptoms, they need to be seen. If they are not seen within 48 hours, you will notice through here, and I'm not going to read it all to you, but you will notice all of those things that can happen with someone who is presumed positive or waiting for their results. This is a lot to digest. We will include the protocols as well as the flow charts for you in an upcoming newsletter. We want to emphasize how serious we take a lot of the items that we can do environmentally to really prevent the spread of, we do it as best we can to prevent the spread of really any virus. Classrooms are cleaned on a very routine basis. Each classroom has a cleaning solution. It's a squirt bottle. Classrooms have cloths to wipe down surfaces, the high-touch surfaces. Common areas are hit many times a day by our custodial staff. They are walking around, wiping doorknobs, wiping railings, wiping as many surfaces as they can throughout the day. And we do set the benchmark that every common area surface is touched and cleaned 3 times a day minimum. Our restrooms, the lavatories, they are checked, and we make sure that all of the sanitary items are really there in plenty. We make sure garbage is not overflowing. We make sure that the paper towels, toilet paper, sanitary napkin dispensers, soap are there as much as possible. We also have areas throughout the school that have, the disposable masks, the hand sanitizer stations. We want to make sure that everybody has ample opportunities not only to be safe from germs that could be virus that could be on surfaces, but also that we make available all of the items that can help them stay safe and clean. It is incredibly important that we maintain social distancing, that we absolutely wear our masks all the time. The only time we really should be taking our mask off is when we are seated and eating our lunch. Now, yes, we do have some small opportunities for mask breaks, but those really should be small opportunities. The masks, remember, they're not chin straps. They are masks that have to cover our nose and mouth to make sure that we don't have any water droplets leaving our personal space. We want to make sure that we also are washing our hands diligently and properly. You know, you sing the happy birthday song to make sure that you're spending enough time washing and making sure that your hands get nice and sudsy so then you can rinse them off. Please note that it's not the temperature of the water that keeps your hands clean. It is the amount of vigorous motion and suds that we create to scrub our hands, and then the water simply rinses off the contaminants. If your hands are soiled, never use hand sani. Wash the hands. Keep those patties clean. Thanks.
Thank you, Mr. Tenney. As you can see, very knowledgeable. So we really appreciate having his expertise in the work that he's doing. I'll turn it over now to Mr. Schrage, who will really focus on our instructional updates. Mr. Schrage, thanks for being with us.
Thank you, Mr. Farr. I'm noticing in the closed captioning it's referring to me as Mr. Froggy, which is a lot of fun. So good evening, everyone. Just want to give you a few updates about what's happening with all things curriculum.